Good evening, everyone. Welcome to another Conversations with Carrie. Today, I have the honor of speaking with Dr. Lesline Davis, an accomplished dental surgeon based in Jamaica who serves in the public health sector with the Southern Regional Health Authority. In her role with SRHA, which covers the parishes of Clarendon, Manchester, and St. Elizabeth, she delivers essential oral health care and works actively to upgrade regional health infrastructure, including public dental clinics. Known for her community outreach, Dr. Davis plays a hands on role in public health education across Southern Jamaica. She frequently leads initiatives aimed at instilling positive oral health practices in primary and secondary schools and hosts regional quizzes and guides youth awareness campaigns. In addition to her public health service with the Southern Regional Health Authority, Dr. Davis also provides comprehensive family dental care in her private practice, operating under a personal philosophy centered on compassion, community, service, and patient focused care. Dr. Davis, welcome to Conversations with Carrie.
Thank you so much for having me, and that was a very lovely introduction. Thank you so
Ah,
much.
well, it only gives a snapshot of what you do on a day-to-day basis. So, Dr. Davis, can you please just help us to understand what your role is with the Southern Regional Health Authority and kind of give us like a state of affairs, so to speak?
Okay, so I am the parish dental surgeon within the St. Elizabeth Health Department. So I control the public dental services for that parish. We used to operate out of six dental clinics. Unfortunately, Hurricane Melissa destroyed our Black River Clinic, but we still have operations in Balaclava, in Magotay, in Santa Cruz, Junction, and Southfield. No, I don't work alone. I head a team of committed individuals who are civil servants who want to advance good oral health care for those who access public services. So currently, the team is comprised of myself, seven dentists. I also have six dental assistants, two dental nurses, and three. That's the team. For a population of us, the St. Elizabeth population is about 153,000 persons. So, yes, what we do, we try to take care of, basic oral health needs for the population in terms of general examinations. We do see a lot of emergencies and do, emergency treatment. Somebody coming in, adult or child with a swollen face, a toothache, child not being able to sleep at night. We handle those. But we do outside of extractions, we do cleanings, we do fillings, we do fissure sealants, we do fluoride treatments. And there's actually a program run from the region where for special needs individuals who need treatment, there's a program where we can arrange and refer them for sedation at Mandeville Regional Hospital. And, while they're sedated, they can get their oral health needs taken care of. And that's if you're special needs. Um, you know, Unfortunately, we don't have enough clinics. and we don't have enough personnel to actually serve the population. So we're always overbooked, and with more support, we can definitely do much more.
All right. Thank you so much for that, Dr. Davis. Now, Dr. Davis, we've been trying to get together for weeks. And I see you're driving, but we decided to go ahead with this conversation anyways because it's kind of a one in a million shot. Can you share with us what you're doing?
Well, actually, so we had a health fair on Tuesday. This was
Uh,
at the Black River SD Church. But to make these things happen, we don't have portable equipment, so
oh,
we have to borrow. So I, because Black River has been shut down since Hurricane Melissa, we
mhm.
anticipated that a lot of persons would show up because they've been without the service at the clinic for so long.
Right.
So we bought some chairs to Angels Mobile, Pharmacy Mobile. They were able to lend us two portable chairs, and we also borrowed three chairs from the Jamaica Dental Association. So, a lot of times I have to do the transportation. So these chairs, well, the ones from Mandeville, I live in Mandeville, I can easily return to Three Angels. But those from the Jamaica Dental Association, through Dr. Sarah Tibby, they have a health fair on Friday.
Mm.
So I need to return those chairs to Kingston. So because I never worked out of Santa Cruz, today I'm going to pick them up in addition to some instruments that were loaned to
Oh,
support the
wow.
health fair. So those would have been bagged, washed, bagged, and sterilized, so I can return them so that they have clean instruments for their clinic on Friday. Yes, that's how we operate.
So, oh, Dr. Davis, let me tell you, I'm going through a couple of things right now as I'm speaking to you. Because when we had the Global Healthcare Conference, you and four of your dentists actually came to Silo, and we had to borrow chairs, and I think you had to borrow some instruments, etc. Because one of the things we don't talk about is when the hurricane destroyed the healthcare facilities, they also destroyed and swept away equipment and supplies, and things were destroyed. And in an effort for you to continue delivering care, you're borrowing chairs and you have to travel from Santa Cruz to return them into Kingston at this hour, which is at uh 5:50 p.m., and then to go back to your house.
Yeah, oh yes, that's fine. That's fine. I don't want to say it's a regular thing. So if I did not anticipate such a big clinic for Black River, then
Yeah.
I would have just used the two chairs from
Okay.
Three Angels. But because
Right.
I know the demand at Black River would have
Right.
been great, we
Right.
needed more operators, more support. So
Right.
then I would push. No, sometimes we have assistance with the transportation, which is
Yeah.
through the Jamaica Defense Force.
Okay.
If they're able to help with that particular health fair, they can transport equipment and even offer personnel
Oh,
as well.
that's
The parish does have transportation, but as you alluded to before, vehicles were damaged with the
yes.
hurricane,
Yeah.
and so they're running a tighter ship, so
Yes.
to
Yeah.
speak. Yes.
Right. During the health fair that we had during the Global Healthcare Conference in St. Elizabeth, uh, our records indicated that you guys saw about 106. patients. Now, there are people in St. Elizabeth, in Silo, St. Elizabeth to be exact, that they kept laughing and smiling and saying how grateful they are because they were in dire straits. You mentioned persons coming in with emergencies. Some persons sit with their emergencies until it gets so bad. And so we want to really thank you. We really appreciate all your efforts, especially seeing that the Hurricane Melissa has made your work even harder. Okay. So, can you tell us about your social outreach? During the conference, you spoke about the smile gap. Would you like to
Definitely.
would you like to share with us about what is smile gap and how do you administer to it?
Well, I mean, the first thing is, dental treatment is expensive, right? So
Yeah,
it's expensive everywhere, even outside of Jamaica.
yeah.
Some persons have insurance, but in Jamaica, that percentage is quite low. Only 19% of Jamaicans actually have health insurance.
Oh, wow.
Only 19%. And so usually like teachers, persons who work for the government, nurses, police, fire persons, they would have insurance. But for the average citizen, they do not have health insurance.
Oh,
And the
wow.
average citizen also does not make enough income to properly address their oral health needs and concerns,
Mhm.
which is a fact. And that plays a part in why people delay treatment. I mean, fear is another story,
Right.
but definitely cost is a factor. Now, in St. Elizabeth, you have another spin to it,
Mhm.
whereas you are a rural parish,
Yeah.
a parish where private dental services are only offered in Black River, Junction, Santa Cruz, and Southfield, big towns, but not
Yeah.
in rural areas. So persons are definitely finding it very difficult to even have good accessibility to
Right.
quality dental services, which is where the public sector comes into play,
Mhm.
because we're there to help to plug that gap and also doing a little more. We're not just taking out teeth. We're
Right.
trying to clean teeth. We're trying to do some filling, some sealants. Are we able to access everybody in the population? No, our team is small. The capacity for clinics,
Right.
it's not as large as it should be, but definitely, if we see disease when you come in for something, we're going to offer you an appointment so that you can be stable dentally. We have special groups that we
Yeah.
focus on. Children is one, diabetics, because we know that link between oral health care and diabetes. Also, antenatal pregnant patients as well, special focus. We also have a dental program which started with the ministry.
Mhm.
And for those persons who are under 60 missing a front tooth, there are rehabilitative services. I always say, like, it's free in government, may not be quick because
Yeah.
currently the lab is in St. Anne,
Yeah.
that we use, but definitely it'll be free and you'll get a nice denture at the end of it. Um, Junction is being refurbished, and a space has been slated for us to have the first government lab in Jamaica to make
What?
dentures. Yes. So, we're looking forward to that. So then
That's
we can
exciting news.
expand. Yeah. Mhm.
Yes. Yes.
Yeah. Hmm.
So, Dr. Davis, you mentioned yourself and a team of six, and that team.
Seven dentists,
Okay.
plus
Yeah.
me. So I'm the
Uh-huh.
eighth
Okay, so
one.
that's eight. Okay, okay.
Six assistants,
Six
three
assistants,
hygienists,
three
and two
hygienists.
dental nurses.
And those are for the entire Saint Elizabeth.
Yes, just for St. Elizabeth.
So how do you manage the various locations? Because you mentioned Balaclava, Magotty, Black River, Santa Cruz Junction, and Southfield.
So we have a schedule, which I create the schedule.
Yeah.
And so, like, Magotty is a one chair facility.
Okay.
Balaclava has two chairs. Santa
Okay.
Cruz has three chairs. The New
Mm,
Junction will have three chairs.
okay.
Southfield has two chairs. Black River had one chair, but
Okay.
Black River would be slated, hopefully, I would say in a year or two, for expansion, where hopefully we'll move to three chairs.
Right.
So that's how we rotate through. And
Mhm.
remember, some of what we do is oral health education.
Right.
Um, we go to the infirmary.
Mm,
Um, we go to schools. So
right.
that's how. There's also a toothbrushing program. Currently, we
Yeah.
just have one school, which is the Lenoir Blake ECI in Burnt Ground, where
Mhm.
we actually encourage every child to actually brush teeth at school so that the sugars
Okay.
are not on the teeth for a
Oh,
long time. They're less likely to have cavities. So, with, more personnel, more assistance, more mobile support, we're
yeah.
able to do more in terms of those programs.
Okay. Would you like to add another school?
Okay. If we would like to add another school, oh, definitely. That's the goal. You're thinking about a school in Silo
Yes.
or Appleton. Appleton has an ECI.
Oh
Or
yeah.
which one? Yes.
Okay. Well, we can talk about it. Definitely. The principals will
Definitely,
have to make the
definitely.
decisions, but yes, we would
Yes.
really, really love that. So, so in with the smile gap, it's about delivering access to dental care to those who would not necessarily have access to it. Okay. So, and we've spoken about your workforce. What would your ideal workforce look like?
Well, before we start talking about workforce, we
Mm-hmm.
need more clinics.
We need more clinics. Okay.
Yes, we need more clinics. So there are areas without dental services, like a new market, a
Okay.
Malvern. So, we need more clinics. And with that, more
Mm-hmm.
dental surgeons, but the dental surgeons work in tandem with the dental assistants.
Right.
So, we need more assistants. We need more
Okay.
nurses and hygienists and therapists to expand our toothbrushing programs or school-based programs as well. So building capacity, and with that we can expand the team.
Okay. All right. So, have you ever used teledentistry, and under what circumstances do you think that would be applicable?
Yes, so definitely, I what it would be unofficial teledentistry, because we're in the age now where we have to protect patients' data.
Yeah.
And so, of course, you have to think about, how you retrieve data, if you get consent, how you store it, etc.
Right.
But often even right now in Senti, two of my dentists are dental interns
Right.
finishing up their internship. So,
Okay.
say for instance, they're in Balaclava, and sometimes I'm there. Sometimes there will be a out of the ordinary case, and maybe a picture would be shared, and the case would be discussed, and we sort a treatment plan over the phone.
Okay.
That happens.
Right.
Sometimes I would get a call or WhatsApp picture from the infirmary, from a
Right.
school. This is what just happened. What do you advise? And
Right.
based on the picture, we can actually decide whether it's an emergency or or not.
Okay.
I'm sorry, a message came in.
Okay.
Yes. So we do utilize teledentistry, um,
Okay.
facilitate seeing our patients, but not in a very formal way. It would be nice if we could sort of build in specialists with the teledentistry, but we do that informally as well. We'd
Right.
send a picture of a patient or an X-ray, um, to a specialist if we need a specialist opinion.
Right. Okay.
Yeah. So, yeah.
All right. So, Dr. Davis,
Mhm.
as we're here talking, I'm beginning to form a picture in my mind. So we spoke about teledentistry. However, are there any mobile dental clinics? Sorry, yes, mobile dental clinics um, available? If not, is that something that the Southern Regional Health Authority would consider? When I think about, for example, Silo, which is considered deep rural, and we do have clinics close by. We have the clinic in Balaclava, which is about 6 miles away, and Magotty, which is probably about the same distance away. All right. So, two questions in one. Number one, you mentioned needing more clinics, but you mentioned far out places that I can understand, like the New Market, which is a little away from Black River, and Malvern, which is kind of equidistance between Black River and Junction. Okay. Now, uh, what do you think the role of like a mobile clinic would play even in the interim?
Definitely. Oh, that would be great if we had a mobile clinic, and that's information that has been given to ministry, that has been given to the region, and we're just waiting for this mobile to come. Very recently we had a meeting with our chief dental officer, and we're hoping that there would be a mobile for the three parishes, Clarendon, Manchester, and St. Elizabeth, and it would rotate through the
Okay.
existing mobiles in Jamaica. Some of them come at a cost,
Right.
which is a lot. And like Three Angels usually doesn't come at a cost, isn't
Right.
always available. Sometimes the mobile may be down. The
Right.
Colgate mobile, which is currently down, is only for children. So,
Okay.
if you have that fear, then adults won't be able to be seen. So, a mobile would definitely help us in
That's
having making the treatment more accessible.
okay. All
Mhm.
right. So you mentioned the supporting organizations, the Three Angels, they were very supportive also during the conference. And of course, Colgate, we did reach out to them also, and they mentioned that their unit was down. And so what I'm getting is number one, the efforts that are being put out, even in spite of the challenges. Now, you mentioned at the beginning about the population in St. Elizabeth. And well, the recommendation is for dental care, seeing a professional dentist, or at least getting oral cleaning at least twice per year. Do you find that this is something um, that is possible, or what's the best case scenario with your current team and resources?
Right. So whenever we go, because we have an oral health education program,
Yeah.
whenever we give our talks, we say to patients, ideally every 6 months, but at the very least, once a year.
Okay.
What you find when persons come in, an assessment is made. What's your oral hygiene like? What's your level of disease? What's your risk for various diseases, whether it's a cavity or gum disease? And based on that, a return program would be tailor made for you. So you may
Right.
come to the dentist. We have a few patients meticulous with oral hygiene,
Mhm.
don't have foods that are not good for teeth. You
Mhm.
can come once a year, or maybe if you come every 2 years, then you're still in good stead. But for some patients, and especially special groups, we would like to see them every 6 months.
Number six
And
month.
the capacity that we have at the clinic,
Mm.
um it could be more. There's room for improvement in terms of building capacity.
Oh,
But those that reach out, we do try to accommodate.
okay. Right. So, what role do you think the private individual and public sector can play in terms of meeting some of these identified needs for more staff, especially dental hygienists? You highlighted those,
Right.
and nurses, in terms of resources, in terms
I
of
mean,
clinic.
definitely supports mobile, if not a mobile bus, definitely mobile equipment and armamentarium. That would be, mobile chairs, headlights so we can see,
Right.
mobile equipment, enough instruments so that we wouldn't have to close a clinic to go to a school or go to a health fair, because we
Right.
have enough instruments in terms of quantity so that both things can happen at the same time. One staff
Right.
will allow. There are persons in St. Elizabeth and other parishes who have qualifications to study dental assisting, to study dental hygiene, even to study dentistry. Sometimes they need financial support, so even
Right.
scholarships for individuals, so
Okay.
that they have help to to go and study. Some individuals, they would have childcare issues. Even
Right.
if they find the money, have a child, he or she's in school, that's what makes it difficult. So, there's room for persons to help.
To help.
Disposables, we always need in dentistry.
Right.
Anything for infection control, gloves, masks, disposable coats, PPEs, cavi wipes. I mean, we always need, whether in the clinic or at a health fair or
Yeah.
at an outreach.
All right. Thank you so much. And so, when we look at, uh, well, y- you work privately, but you also work with the Southern Regional Health Authority. And my experience in dealing with like government-based organizations, there's usually a lot of bureaucracy. Um, are there any possible, maybe policies that you would like to see um, to assist with improving dental um, dental care delivery?
Well, that question sounds like it's above my pay grade.
Oh God,
But even in terms of bureaucracy, we
yeah,
have to think about, just accountability as a part of why there's that bureaucracy, just to
right,
make sure, things come in the right way and they're distributed the right way. And that's why there are certain rules. I'm hoping, and the ministry has started making the move for things to be more electronic. I'm
yeah,
hoping that with such a move, that will make the red tape, so to speak, a lot less.
oh,
But there's definitely room for improvement. Getting things in, and if you're like a charitable organization and you're registered, that should make it a lot easier.
right,
And sometimes, for instance, you know, I may be able to talk to the chief dental officer who can advise, if somebody wants to support, say, the dental department in St. Elizabeth,
right,
or that person, wants to have a health fair. I can be contacted and I can sort of facilitate you talking to the right persons that can make things easier. That should make things easier.
yeah.
But I don't think
But
that red tape will disappear, because a part of it is just making sure there is some level of accountability.
yes. So yeah, so I've had really great experience working with the government and of course the Southern Regional Health Authority with our health fairs, etc. But I do wonder, when we think about healthcare, a lot of times we go immediately to like doctors and nurses, but very rarely we hear about the dentists. And so I was wondering if, and you have all these initiatives coming around now, like Know Your Numbers and for mental health, etc. So I was, is there anything in that regard that you would love to see the government kind of focus on for dentists? Because usually when policy is made, finances go behind it to make it happen, right? So if you had one thing that you could say, um, this is what I would love to see, what would that be?
Well, something that immediately comes to mind, and I mean, it's not just one thing, but let me talk about the schools, because sometimes, usually we don't just go into the schools and start doing treatment on children.
Right.
We engage with the parent teachers associations.
Uh-huh.
We talk to the school, the principal, we arrange a day, we do consent forms. Parents have to, opt in. And what you find, children with the highest level of disease, sometimes their parents don't sign the form, could be
Okay.
due to literacy, could be not thinking is important. So something to raise that level of awareness that we do have public sector dentists who do go out into communities, who do go to schools, and who are available to actually do examinations on your child. And if something is found that cannot be treated in the outreach, then we actually pave the way for you to get the treatment in a health center or otherwise. So definitely more education, so we get more cooperation from the parents, is something I would love to see, in particular for school-based children. But you're right, in general there's room for a huge mass media campaign
Mhm.
for dentistry. But that's another thing. Do we have enough clinics for that capacity?
I think it goes
Even
right back to that.
yeah, because when we raise awareness, we need to have hands on board and operatories so that we can treat. So
Right.
patients will come. Even now when we do a talk, oh, I didn't know you do cleanings at the clinic. So people are hearing, I thought you only did extractions, or oh, I didn't know I can do a wisdom tooth, a surgical extraction at the clinic.
Right.
Oh, yes, we do those too. So people are knowing more about our services and are accessing them. So we need to be growing with the number of patients who are actually coming in, because even in Senti, when a health fair is happening, they have like a town crier. I'm
Yeah.
like, we need to be careful because you put dental in that ad or on that flyer, patients will have a huge expectation and will show up. And if more show up than we are able to handle, then there will
Yeah.
be, this disappointment and, dissatisfaction. And we try to tailor it so that that doesn't happen, you know?
Yes.
So, yes.
Well, what I would love to see personally is, say, for example, um, a concerted effort to, as you have the school program, is for a concerted effort to expand that. But I do understand the current challenges for that. So I really applaud um, applaud that particular program. And I would love to see that one extended because if you can catch the smiles before the cavities go in, then can you imagine that smile for the rest of their lives?
Rest of your life. And then for your children,
Yeah,
that's what like when we're doing all these extractions, I say in my talk, I did not become a dentist to take out teeth. I
yeah,
became a dentist to keep people smiling, and so people
right,
don't have like the discomfort of a toothache.
right.
So why keep that bad tooth in your mouth and wait for an abscess or a toothache? And that's why we're going to the schools, and that's why we have the toothbrushing program. The toothbrushing program is for early childhood institutions, preschools. So we
Okay.
start the good habits early.
Young, yeah.
Something that there's room for improvement as well, because we tell our patients what's going to make you healthy is not just what happens when you come to the dentist, it's what happens in your community.
Yeah.
Also what happens at home is what happens at school. What are you eating and drinking? When I go to give talks at schools, I check out the talk shop. What's being sold to children?
Bunnies.
Yes, and then is there a lady at the gate or some ladies? What are they selling?
Yeah,
So there are a lot of environmental challenges
yeah.
in Jamaica, even, to get a soft toothbrush, if the nearest shop to you only sells hard and
Right.
doesn't sell dental floss, it's going to affect your oral health. But
Right.
in terms of nutritional policies, there is a nutritional policy for schools.
Yes.
Is everybody adhering to it? I don't think so. Is it being properly enforced? There's room for improvement, but we are heading in the right direction because, good nutrition is not just about oral health care, it's diabetes, it's hypertension, it's lowering cardiovascular risk factors. So it's an important message to have, and it's an important policy to ensure that it's enforced.
Right. I'm glad you mentioned those because persons don't recognize the importance of good dental hygiene to health. And as a nurse, a person comes in and they're sick and they're in the ICU, and poor dental hygiene can cause pneumonia,
Yes,
right? It can cause
yes,
death.
yes, it can.
And so, yes, and
Mhm.
so we don't want to scare people with that, but it's very, oral hygiene is more important
It
than,
is.
it's made or is known in the public. So, Dr. Davis, where are you now?
I actually stopped because I didn't want the reception to
Oh,
break for your recording. So, just before we wrap up,
yeah,
just to, because you just touched on it, that mouth body link, it's
yeah,
important. And, it's important that persons know that it's not just teeth, it's not
right,
just gums, it's a part of your body. And if you have an infected tooth, that infection goes in your blood and affects other systems. If you
mm,
have gum disease, the inflammation, it doesn't stay in your mouth, it goes in your blood and it affects other systems. For example,
mm,
a pregnant mother, studies have shown that if a pregnant mother has gum disease, those inflammatory markers enters the blood of the mother, affects baby. She's more likely to have a miscarriage. She's more likely to have a premature baby. She's more likely to have a low birth weight baby. She is more likely to have preeclampsia, where her blood pressure goes up.
right,
And this is just from gum disease. Other studies have been shown to link diabetes and oral health. Just getting rid of the inflammation in your gums.
right,
It can make your diabetes control better. It reduces risk of, strokes, heart attacks.
right.
Recent studies in terms of gut health and Alzheimer's. So it's not just teeth. So don't ignore a hole in your tooth. Don't ignore a shaky tooth. Don't ignore gums that bleed. Don't ignore if there's a lump or bump or an abscess in your mouth. Even if it's not hurting,
Mm.
that you should move to have it properly examined so that you can be properly treated.
So, Dr. Davis, I really appreciate you and what you and your team are doing. It was such an honor to meet you at the conference, and the community, as I said, they are very happy, very appreciative. They, days later, this lady came and smiled in my face and told me thanks
Mhm.
because, she was really suffering, and so we're able to give her some relief from her oral discomfort. And the Parish Ground Global Ministries, as you know, we conduct health fairs, and since the hurricane, we've had to borrow chairs, and so we're asking our audience to help us. We're trying to get 3 chairs into Jamaica,
Right.
into the St. Elizabeth area, so that we
Mhm.
can, support what Dr. Davis and her team are doing. And believe me, the population will, they're thankful for it. And as Dr. Davis
Can you
also,
see the chairs that are some of the chairs that are borrowed in the back?
yes, yes, I can see some in the
Yes.
back. They're folded there in the back. Yes. And
Yeah.
that's
Mhm.
having to go all the way back into Kingston. And
Mhm.
of course, you also mentioned the disposable equipment. And
Mhm.
so, of course, it's going to be on our list. That's something we're going to work on. We may not get everything all at once, but it's going to be a permanent part of our efforts on an ongoing basis. Oh, what a fantastic eye-opening conversation today with Dr.
Mhm.
Davis
Thank you for
from
having me.
Thank you so much, from community
Mhm.
outreach in schools, the vital work in the various communities in St. Elizabeth. And with all of this, also her private practice, Dr. Davis, I do not know how you do it,
Yes.
but
Yeah.
we truly appreciate you
Mhm.
making such a big
Mhm.
difference, affecting person's health, both physical and mental.
Mhm.
Even though we didn't touch that part today, but we know when a person can smile confidently, it's a great
Definitely.
boost to
Self-esteem,
yes, yes,
self-actualization, kids
yes,
talking up in school,
that's
passing that job interview, being confident,
yeah,
definitely related to mental health as well.
right, and confidence. So, Dr.
Hmm.
Davis, it was an absolute pleasure speaking with you today. To our audience, thank you for spending this time with us. Stay safe, keep healthy, keep smiling, and join us again.
Thank you so much.
Thank you. Thank you so much, Dr. Davis. And I look forward to seeing you, my audience, for the next meaningful conversation with Carrie.